We basically came to Bungoma given the media, a lot of negative media attention that the county was getting. So there was a case where someone delivered on the floor and the county was supposed to pay her according to a court order. There was an episiotomy that went wrong in one of their facilities. The needle broke. And so we just came here to Bungoma to just seek to know what was going on, what was the problem, where was the gap, and how could we come in to solve that problem. So we first came to the county officials and we just discussed what we wanted to do in the county jointly with the Center for Reproductive Rights, who was really key in the case of Miss Majani. And so we came to the county and did a county entry. We met the director, we met the reproductive health coordinator, and we got their blessings to get into the facility. At the facility, we had a meeting with the administration, and then we set out to do a baseline assessment at the facility. So the baseline assessment came up with a lot of gaps in terms of quality of services. The number of staff were not at optimum. The general service provision was being hampered by a lot of different inadequacies that were being experienced in the facilities, So we noted that some of the gaps needed the attention of the executive, some needed the attention of the administration. And so after collecting the results of the focus group discussion, we compiled a report, and we disseminated that report at the hospital level. We disseminated until the executive level.
At the time we started maternal health advocacy, there were some recommendations, short-term recommendations that were made basing on the challenges that were on the ground. Number one, staff did not have identification tags. But now, every staff in this hospital has, and you can be able to identify and say whether it is a nurse, a doctor. We have the names written on plus each person's cadre. Secondly, babies were also not being identified. They didn't have identification bands. They could only be identified by maybe the mother's lasso. But now we were able to start purchasing the identification bands for the babies, although at times they may go out of stock, and at such times we can improvise by even labeling with the strapping so that we don't mix up the babies. Then we also had an issue with the referrals because by then we had no ambulance. Our ambulance had broken down. And the county managed to give us a new ambulance, which had been purchased by the county. Then our old ambulance was also repaired, and we were added another extra old ambulance from one of the sub-counties, which had been given a new one, so they gave us the old one. So currently we are having 3 ambulances, and it has really reduced the problem of referring patients. We didn't have curtains, especially in the delivery room. So there was no privacy in that room because we have 3 delivery coaches, and there was nothing that was partitioning the coaches so that a client on one coach could see what is happening to the next 2 clients. But we managed to purchase curtains. Now we can enclose one coach so that there is privacy in that, whatever is happening in that coach. I want the Bungoma County Referral Hospital to have no maternal deaths. And if it must happen, let it be very minimal and maybe what we couldn't, and inevitable, let me say. But I would want no maternal deaths happening in this facility.
My name is Rosemary Mwachie. I'm a resident of Kandui constituency in Bungoma. I prefer Bungoma County Referral Hospital because it is near where I stay. It's within town and I can access it easily. I have been a new mother, which means I used to go to Bungoma Referral Hospital for my clinics while pregnant, my prenatal clinics, and I liked their services because one, they take you through morning trainings. They tell you how you should prepare yourself during the pregnancy, before delivery, after delivery, how you should take care of your child. They also train you a lot in terms of being careful to just know which diseases you could likely to contract while pregnant, or maybe even your child, and how best you can protect yourself from diseases like malaria. They take you through the lessons, and you have a chance to actually ask questions with the nurses regarding your pregnancy if in case you're facing any challenges. I like the hospital because of its maternity wing, which has been really improved. Compared to most public hospitals, you might find that there are no beds, there's no space and clean facilities, but in Bungoma County Referral Hospital, the hospital is clean, the maternity wing is clean, the newborn unit is so wonderful.
Proud of the progress so far, and we believe that in a number of years this facility would be a model facility for other people to also come in and just to benchmark with them on how they made it work over such a short period of time. I see it as a center of excellence for other facilities, because one of the things that I have really admired working with them is how they took up these issues without wanting to lay blame or wanting to pretend that that was not what was really going on. They accepted the assessment report as they were, and they have been really working hard to ensure that they reverse some of the trends that have been going on in the facilities.